Good evening, and welcome to Fresh Natural Live. And I hope you've had a great Monday today. And of course, I hope you had a wonderful weekend. As usual, we have a great show scheduled for you tonight. We're going to talk about the immune system and autoimmune diseases. Now, of course, this is part of our series of talking about health conditions in the context of supplementation. And the reason we're talking about health conditions and the broad natural approach instead of just talking about supplementations is that we want to put supplements in the proper context of managing health conditions. And so instead of saying, well, this herb is good for that and this herb is good for the other, many of you who have been following us during this series, as we've talked about supplements, really know that we are all advocates of putting supplements in their proper place as supplements to your health, as supplements to your health plan. So they shouldn't really take the forefront of quote unquote treatment sources, but rather they should be supplementation or supplemental, if you will, to your health condition. So tonight we're talking about autoimmune disease and natural approaches to preventing and reversing it. And my esteemed colleague, Dr. Pam Atkins, will be leading this discussion. So I want you to get comfortable, sit back, and let's get ready for a wonderful presentation. Okay, welcome back. Welcome back. I see we have some people online. Our wonderful hardcore standard bunch. Catherine, hello. GMO, hello. As I said before, we're going to be talking about the immune system and autoimmune disease. And I look forward to this presentation because really autoimmune diseases affect a lot of chronic illnesses. And so it's going to be something that really encompasses a lot of health conditions, a lot of chronic health conditions. So I think I anticipate learning a lot. So I think you will too. So without further ado, I want to welcome my esteemed colleague, Dr. Pam Brewer. How are you doing? Dr. Atkins, how are you today?
Hi, good evening. I'm doing great. Good to see you. Good to be here to share.
Hope your Monday's starting off okay.
Doing well, doing well.
And Dr. Celeste Palmer, how are you today?
I'm well.
How are the kiddos? the kiddos in the clinic. Now, anyway, and so Dr. Floyd Atkins is here. I think he's not quite on camera yet, but I think he's going to be joining us. I will bring him on once he's available. There he is. Hello, sir. How are you doing? As I said in the outset, autoimmune disease can have a broad effect. I mean, I see patients in my office with, conditions like lupus and rheumatoid arthritis, and many of them have heart disease and vascular disease, kidney problems, and the like. And so autoimmune disease is a systemic disorder that affects, the whole body in many different ways. And so it tends to overlap with a lot of other conditions. And so I think this is going to help us in a lot of ways. So Dr. Pamela Atkins, I look forward to hearing what you have to say about this topic tonight. You, before we get into your discussion, what are some of the issues or some of the problems that you have faced over the years dealing with patients with autoimmune disease, and what's been some of the challenges that you've been faced with and helping individuals with these kind of health issues?
Yeah, I think what I observe is the cause of it is multifactorial. It's not just one thing. So it is challenging to juggle, to try to address the different possible triggers and possible causes of it. And it affects so many organs in the body, and that's the thing. And so that's the challenge I find.
Yeah, yeah. No, I hear you, and that's something that we face as well. And we get so many organs that are teetering. It's hard to kind of get things into balance. So I know we were having some technical issue with your slides earlier. Have we gotten that sorted out? We got.
I think we do. I think Dr. Floyd has my slides, so I think if you let him share, I think we'll do it from
Okay.
his side,
No
and
problem.
I'll just advance it that way, if that's okay.
That's perfectly fine. You want to go ahead and put that
Okay.
on share screen? I can bring it up once it's on share. And while he's doing that, Celeste, do y'all see much autoimmune disease in children?
Yes, I mean, some of the same things that you will see in adults is starting to manifest in children now, because children are eating a lot of processed foods. And I'm sure Dr. Atkins will kind of speak about how that plays into affecting the immune system in a negative way.
Yeah, it's I remember certainly my exposure to young kids is more them coming in with type 2 diabetes and high cholesterol. And I remember in my training, the young kids, they had type 1 diabetes. We call it juvenile, and then the adults had type 2. And I distinctly remember as a medical student that we didn't see type 2 diabetes, and for the most part, people were in their 40s and 50s. And so I see your slides now, and so it's interesting now. Of course, now the younger people have type 2 diabetes, and of course now, as you said, they're getting other adult diseases. So the kids they're growing up fast, as they say, in the wrong way, unfortunately.
In the wrong way, yeah.
Let me bring up your slides here, and let's see. Let me see if I can enlarge it. There, yep. And I think we got it there. So looks good on this side. I'm going to take it away.
Okay, so can you hear me okay?
Yes, ma'am.
Okay, so we're talking about our immune system going wild, autoimmune diseases, and we want to address, how common it is and how we see it, and how diverse it is in the body. So can we go to the next slide? Okay, so when we say what is an autoimmune disease, what we find is our body's immune system is reacting against its own tissue, its own organs, and it's making antibodies to the tissues and organs, and that can cause inflammation and destruction. So we see more autoimmune disease in women than men, approximately 3 times more. And so some people suggest that it's due to hormonal levels. We're not sure. Now, in the history of autoimmune disease, Paul Ehrlich identified in 1908, he identified or coined the term, he called it the horror of autotoxicus. I think, Dr. Floyd, you have some feedback from your, if you can mute. Okay, thank you. Okay, and then there are approximately 80 to 100 different autoimmune diseases. It's very, very diverse, and many. It's more. I was overwhelmed. It seems like more and more added to it through the years of my study in medicine. We believe 80% has a genetic influence, and but what we know about genetics that we have some influence on our genetics. Just because it runs in our family doesn't mean we have to have it. So we talk about epigenetics having more power over it, changing even if we have a genetic propensity for certain diseases, because what we learn from our family is, how to eat, and we're used to certain environments, and so that's passed on. But 70% is considered environmental influences, and those things we have a lot of effect over making changes. So we think autoimmune disease, they say approximately 24 million people are affected with autoimmune disease or diagnosed, but some of the it's proposed that it's as many as 50 million people may be undiagnosed and diagnosed together totally with autoimmune disease. And NIH, or National Institute of Health, says it's the 8th leading cause of death.
You know, it's an interesting point that you make about the potential underestimation of disease there, because, you know, I often, I see a lot of patients with heart failure, and a lot of times we call them idiopathic. And we know in heart disease, inflammatory markers are elevated. And I think a significant contribution to things like heart disease and other acute flare-up conditions are probably somewhat of an autoimmune-like mechanism. People with COPD with flare-ups, or people with autoimmune with flare-ups. I think those are mechanisms that are very similar to autoimmune disease, even if we don't call them classic autoimmune diseases. And it's interesting that there's an estimated 24 million, but it could be as much as 50 million. And I think that wide gulf between those two numbers imply that there are a lot of other conditions that are there that we just don't really put our hands on, because they don't present in the normal packages. And one thing I think our audience may not be aware of, in medical school and stuff, we're trained to think of things in certain packages, that this diagnosis, that diagnosis, but oftentimes a person don't present with a classic set of findings, and so they may not get the diagnosis of autoimmune disease, but they'll in fact have an autoimmune disease. So it's interesting that you pointed out that difference in the potential numbers that we see.
Yes, and I'm just, well, we'll see. We'll see how it's on the rise. So we'll talk about that. Here, we're talking about, the different organs of the body and systems of the body that are affected with autoimmune disease. And it's almost every organ, every tissue. Next slide. So what is autoimmune disease? We think we know it's the third most common category of a disease in the United States after cancer and heart disease. And 3/4 of autoimmune disease is of women, but we are finding out that it's on the rise in men as well. So the men are not exempt. And most autoimmune diseases, well, there's so many autoimmune diseases, and I just wanted to give you an order of the most common ones. And so the most common one, as you mentioned, Baxter, is type 1 diabetes. This is usually we used to call the juvenile diabetes, and that where the pancreas is not functioning properly. The rheumatoid arthritis, number 2. Number 3 is psoriasis or psoriatic arthritis. Number 4, multiple sclerosis or MS. Systemic lupus erythematosus, or we abbreviate it as SLE, is number 5. Inflammatory bowel diseases, which include ulcerative colitis and Crohn's disease. Number 6, Addison's disease. Number 7 and 8 is Graves' disease. Next slide. So just to know how prevalent it is, it's not just the common people, but many of the entertainers, movie stars, people in the limelight have autoimmune disease. And many of us have heard about Venus Williams, I believe Sjogren's disease, and Cyndi Lauper, psoriasis, and that's Lady Gaga, also lupus. We lost Bernie Mac to sarcoidosis. That's Kim Kardashian, and also she has Sjogren's disease, and Wendy Williams has 2, psoriasis, and she is a Graves' disease. So it is very prevalent in our community, more in the African American community and people of color, but Caucasian white people are not exempt. Next slide. All right. So just showing all the parts of the body that can be affected, whether it's the lungs, the heart, the skin, eyes, everything. Next slide. Okay. And this slide comes out small, but it shows the difference. We definitely are what we eat, and the environment of our body affects our health. And so on the right side is the person that's eating more plant-based whole foods, and the person on the left side is eating the typical standard American diet, just eating what you feel like, a lot of packaged foods and hamburgers, hot dogs, potato chips, sodas, etc. And so the person on the left has more headaches, more sleep disorders, more weight problems, more joint pains, many of the symptoms we have in rheumatoid arthritis, lupus, and autoimmune diseases, many of these symptoms, fatigue, and then the person on the left has done far better. So this is a great slide to illustrate, we are what we eat, we are how we take care of ourselves really reflects in our health. And so the more you do the wrong thing, you need the doctors more often. Okay, next slide. Let's see here. So, and this is just showing some of the symptoms. You say, what are the symptoms of autoimmune disease? Joint pains, usually many times multiple joints, not just one joint, but multiple joint pains and stiffness. And I just want to say about these symptoms, all these symptoms can be a lot of other things, and, joint pains, including just osteoarthritis, and not necessarily doesn't mean you have a autoimmune disease, but these are some of the symptoms that overlap with other conditions, allergy symptoms, whether it's fatigue, decreased stamina, difficulty concentrating, focusing, ADD, ADHD. I think many of young people and adults with this diagnosis should be investigated and check on how their food sensitivity and other issues that could be cause or triggers, skin rashes, eczema, thyroid disorders like Hashimoto's thyroiditis, Graves' disease, even the GI dysfunction, diarrhea, constipation, cramping, bloating, these kind of symptoms, anxiety, not handling stress very well, visual changes, double vision, unexplained numbness and tingling that not constant, but usually comes and goes, particularly with MS.
April Holcutt asked about fibromyalgia and costochondritis. Now, those are diseases, diagnoses, but someone with those diagnoses, would that be part of an autoimmune mechanism, you think?
Well, it can, but fibromyalgia is usually like a disease of exclusion. So when you evaluate for other things and you don't find other things, but it's important to test for autoimmune disease and to screen for it, because sometimes symptoms will start and the disease hasn't fully evolved. And they say the average patient, it takes 5 years before they're diagnosed, and they may have had trips to the doctor complaining of symptoms for as many as 6 to 10 visits. So it's really important to investigate. The third most common cause of chronic illness is, as we said, was autoimmune disease, and the National Institutes of Health suspects 5 to 8% of the total population. So almost get 10%, and it's increasing. So that's interesting. And the preferences, as I said, is female to male. Ethnicity-wise, African American first, Native American second, Latino third, and then Caucasian. And so other countries, we see the number one country is Israel. Interesting. And second, we have the Netherlands, and then the USA, and then Sweden. Next slide.
It's interesting. I'm
yeah.
sorry.
Go
That
ahead.
previous data you mentioned, African Americans are top in the United States, but then you go worldwide. You got with Israel and who's second? Sweden.
Yes, Israel, and then we had the Netherlands.
And then USA,
Yes.
then Sweden.
Mhm.
I mean, I don't see an African country there. I mean, it's peculiar
No.
that there's in the United States an implication of genetics being toward the African American population, but when you go worldwide, African countries don't show up in the top 4. That's
Exactly.
quite peculiar. It must be
Yeah.
saying something about our lifestyle here in the U.S. versus our lifestyle in other places. I don't know.
Exactly. That's what I think. Lifestyle and diet may have something to do with
Yeah.
those other countries.
Interesting.
Next slide. So this is a study that was done on 1,400 individuals, 14,000 participants, and they were ages 12 to adult age. And they did simple ANA testing, and ANA for the listeners is anti-nuclear antibody testing. This is the most common test or biomarker to screen for risk for autoimmune disease. And so they did ANA testing for this group, and it was done over 24 years, starting 1988. They did one group of testing, 1988 of this group to 1991, then again 1999 to 2004, and then 2011 to 2012. But this was published in April 2020. So what they found was that the ANA positivity rate was 11% on the first time when they tested and they estimated approximately that correlates to 22 million. Then when they tested the second time, it went up 11.5% to approximately correlates with 27 million. And then on the third time, the third group, it was 15.9%, almost 16%. And that correlated with 41 million. And I'm sure it's much higher because we see these autoimmune diseases on the rise, and rheumatologists are very busy.
There's a question Catherine Welch has: has SLE detection become more precise over the years? I mean, I don't know that it has. I mean, do they have more stuff now?
What I say, it's not precise, but I usually screen with the anti-nuclear antibody test and the SED rate, and sometimes the rheumatoid factor or RA. But it is a disease. The interpretation of it. Number one, the ANA should be negative. A normal ANA should be negative, but when it is positive and weakly positive, like a less than 80, a doctor will say, well, it's really not a concern. It's positive. It's not a concern. But for me, it is a yellow flag that is a problem. And many people that become weakly positive, when they don't make changes, become more positive. So yes, and it's not a definite, the diagnosis is not definite. The symptoms have a lot to do with it. Sometimes patients come to me and say their rheumatologist says it may be lupus, maybe Sjogren's. We're not sure. It's not as exact as we would like it to be. But it can those tests can give us good information, and your ANA should be negative.
I get the same issues as you get. Patients coming in and saying, well, I haven't been given a definitive diagnosis. I got this positive. They think I might have this. And my thinking is, and I ought to get your take on it. My thing is, it doesn't matter what label it gave you. You have an underlying autoimmune process, and we need to address that. So whether we call it, Henry, Frank, or lupus, or whatever, you have an autoimmune. The mechanism of disease, in my opinion, is more important. And now I guess for whatever reason, people want to give it a specific diagnosis. But, I think on the standard treatment side, it's going to be steroids. There's rheumatoid arthritis, it's going to be steroids. It's going to be lupus, steroids. So I remember when I was in medical school, we one of the professors he was doing a lecture, and he was talking about how, it didn't matter what the diagnosis was, like the treatment's the same. And he had this little cartoon on of an animal, differential diagnosis of illness of an animal. So they had diagnosis A, shoot, diagnosis B, shoot, shoot. So, I mean, we fuss over these diagnoses, but I mean, our treatment on either side of the table is going to be very similar, if not the same. And so I think just having something that's abnormal that points in that direction is the most important thing. What's your take on that?
Yeah, I just think I tell people that getting an autoimmune diagnosis or having a positive antibody means your body is out of balance, and it's a time to make a change. And so, like you said, the label is not as important, but what are we going to do about it? Because we want to reverse it. And I've seen people make changes in their lifestyle and diet and reverse. And reverse the symptoms and the antibody, I've seen it go negative. So just because it's positive, or just because you've had a negative antibody this year or 5 years ago, doesn't mean that it can't go positive, especially if you're not making changes in your lifestyle. So it is these biomarkers are good warning signals, the yellow flag. So yes. So and for this, at the end of this study, they found that the largest increase in ANA was with young people. Okay, so I wanted to young people, age 12 to 19. They saw a 2 to 3 fold increase in young people. I was shocked about that, but then I thought about it. I remember going to a college readiness for young people, going to my college, Howard University, and a mother came up to me and she was like, well, where will I find a rheumatologist for my daughter? She's going there. And she said she's diagnosed with lupus. And I realized that more and more young people are being diagnosed, in their teens of these autoimmune diseases. And this was some years back. So I'm sure Celeste, Dr. Celeste, you've see the same.
Yeah, I just wanted to say we're seeing, more positive ANAs, but as you all said, it does not always mean lupus. But unfortunately, children, parents and children, the population in general, they're looking for a diagnosis. And so when they get a positive ANA, or they get some kind of inkling of this may be, if the doctor says this may be some type of disease, they hook on to that. And so even if they can work their way out of that cycle, they don't, because now they're in the mindset of I have lupus. And so they kind of feed into it. And that's the unfortunate part of getting a diagnosis, because I have had conversations with people, adults too, about it doesn't matter what the name is, let's work on getting out of the cycle. But people, it gives them a reason to say I'm tired today, which they really are, or it gives them a reason to say I can't do this today, or I can't do that. And so they kind of hook into that. But trying to switch that mindset is can be a challenge.
Exactly. And so in addition to the young people, men were on the rise, and they saw non-Hispanic white participant on the rise, and all adults over 50 on the rise. And so they looked at it and they said, well, they said that genetically people haven't changed. And this is a correction, in the past 30 years. It says 3 years, but the correction for that typo. But they said genetically the participants the genetics hasn't changed in the past 30 years. So they conclude what? It's lifestyle and environment. And what is our lifestyle environment? Our diet and what we put on our skin and everything. So that was the conclusion. So I agree with that conclusion. Huh?
It's amazing they came up with that.
Yes. So
boy.
Let's see. Okay. So causes of autoimmune diseases. So, what are some of the triggers, or what are some of the causes it's proposed? Because a lot of times you'll look up and they're saying, we're not sure. But in holistic medicine, we're identifying things that we're seeing that make a difference. And when you take them away, many times there can be improvement. Pesticides, heavy metals, pollution, smoking, exposed to smoke, or even secondhand smoking, living with a smoker, and over 100 different medications. There can be triggers, and the heavy metals. We're looking at dental work, amalgam fillings, the silver fillings. They have mercury in it. Mercury is toxic to the body, and in dentistry, they feel a little bit of mercury is not bad. It's a long-term effect. And so we're looking at all these things in addition to, yeast, bacteria, viruses, respiratory type infections, urogenital infections, also viruses like Epstein-Barr virus, measles, chlamydia, H. pylori, tuberculosis. And on this list, I discovered vaccinations were on there, immunizations. And next slide.
Well, the point about immunization is a couple of things. A question about Get My Own. I'm going to make a quick point. There was given the recent, vaccines being talked about, one of the concerns was pathogenic autoimmunity. In fact, there was recent mRNA vaccines that were studied in animals and was found to be very striking for pathogenic autoimmunity. It was for SARS and MERS and SARS vaccine. And so when they gave those mRNA vaccines to animals, the animals died. It was due to pathogenic autoimmunity triggered by the vaccines. And so the immunizations has been well known. In fact, there was a professor at Beta who testified to Congress, I remember correctly, that they've known about the pathogenic autoimmunity with vaccines since the respiratory syncytial virus vaccine 50 years ago. And I didn't know that, but that's something that's been known for some time. And so I think it's great that you pointed that out, given our current environment of, vaccines and all. Get My Own had an interesting question about autoimmune disease in California. She mentioned the Epstein-Barr virus, as you alluded to, and she asked the question, could autoimmune disease be transferred through sex, sharing fluids, public, or animals? I guess the virus can be, so I don't know about the autoimmune.
Yeah, autoimmune disease is not sexually transmitted, but of course viruses and diseases of the like, but having certain infections may predispose someone to have an increased likelihood, but doesn't mean if you have ever been treated for one of these infections that you will get. It doesn't mean that, but there's a risk factor there. This statement, I don't know how well it can be read on the screen, but it's about the vaccine. It says, although vaccines are generally safe with low incidence of serious systemic adverse events, numerous reports highlighted the occurrence of neurological, which could be Guillain-Barré, multiple sclerosis, autism, articular arthritis, rheumatoid arthritis, autoimmune untoward effects like systemic lupus, diabetes, after single or combined multi-vaccine. Now, this was in 2017, so this was before COVID. This came out, but I thought this was interesting. So, and this same study, the same statement went with this chart. This group EPMA out of Europe had a table with vaccines, certain vaccines, and autoimmune disease. It's a diseases that they've observed sometime after they've received these vaccines. And, of course, it's not something that happens usually immediately. I'm sorry, it's so little, and I can, and the reference is up there, but it's that EPMA Journal 2017, September.
I just enlarged a little bit so people could take a picture, so that's good.
Okay.
So that's a good slide. I like that.
So when we think about, we want to think about other toxicity. We just touched upon things, pesticides and chemicals, ECBs, chemicals in soil and the water, benzene that can cause leukemias as well. You see sodium benzoate as a preservative and additive in foods and medications and makeup and things like that. You want to look at that. The leather industry, tanning leather industry, there's some toxicity in all the tanning industry. I want to be careful. Teflon. I know we mentioned it when we talked about our water. Is our water clean? The PFOAs is a common chemical from Teflon, and Teflon is not healthy. It cracks and scrapes and breaks down, and flecks of it get into our water system, and it's not healthy to the body, and we think it's a cancer-causing agent. As well as phthalates, the false plastics that when we store oils in plastics and foods with oils in it, these chemicals, phthalates, migrate, and they are estrogen stimulators. And so stimulating breast, uterus, ovary, prostate, tobacco, of course, pate thinners. But it's good to know we need to be careful. We need to be mindful of chemicals. Even dry cleaning, we need to be mindful of that, because the chemicals they use in dry cleaning can be toxic to the liver. So we want to look, if we must dry clean our clothing that we wear to work or wherever, our uniform, consider our non-toxic cleaners. Next slide. Next slide. Okay. So just the keys to strengthen the immune system, just talking about food and, and whole foods is very important. So we want to go ahead. Were you going to say something? Okay. So overcoming, what'd you say?
No, go ahead. I'll ask that. I see dysbiosis being there. That's an interesting comment. Go ahead.
Yeah. Well, okay. So we want to know, what can we do to overcome autoimmune disease? Because I wanted to get to it. And so number one, dysbiosis, not having enough good bacteria, being exposed to antibiotics. Some people take it chronically, even topically on their skin for acne, or if we're intermittently getting antibiotics more than one time a year or so because of sinus infection, allergies, that can have effect on our digestive system. A lot of our immune system is in the digestive system, at least 70%. And we want to replace good bacteria, the probiotics. Fermented food is a good source of the good bacteria. We talked about it before, but it's very important because the dysbiosis, damages the mucosa of the lining of our digestive system, and we're not absorbing things well, and it causes more reactivity and sensitivity to different items. So that's very important. Vitamin D3, low vitamin D can make us more susceptible to autoimmune disease. So we want to have a good level of vitamin D. Avoiding food with lectins, and lectins are on all these foods, dairy foods, wheat has lectins, soy can have lectin, corn, eggs, beans, peanuts, nightshades are lectins. I mean, some people with joint disorders, sometimes holistic practitioners will say stay away from nightshades like eggplants, tomatoes. These are peppers. These are foods I love, but if you feel some sensitivity to them, then leave them alone, of course. And to stay away from food additives, preservatives, chemicals, all those type of things. And we just want to encourage a more whole, healthy diet. I think I'll speak a little bit more coming up. Also, I just wanted to mention elimination diet. We do a lot of IgG testing, food sensitivity testing for food we're sensitive to. A lot of people will say they went to their doctor or allergist and they had an IgE test, which is an allergy test, usually things you react to immediately, but IgG is more of a delayed reaction, can be hours to days later. So there's out-of-network tests that test for food sensitivity. But for those that maybe can't test or can't afford testing right away, elimination diet. Start eliminating things that you suspect. And I usually recommend some of these foods in the lectin, particularly milk and cheese, cow's milk, wheat, corn, because many corn is GMO and genetically modified. A lot has been done to corn, eggs. These are some of the top peanuts are the top foods that people show sensitivity to. And many times removing these foods, they can get better. But a true elimination diet is like starting with hardly anything, like, maybe 4 foods and an herb, and you add something maybe every 4 days or so. And if you see any of your symptoms come back, then you take away what you've added.
Dr. Atkins, can I add something while you had the slide up?
Yes.
Just because I just want people to kind of realize, when I look at this, I think people feel like this might not directly relate to children, autoimmune diseases or immune system dysfunction, because in the grand scheme of things, people feel like their children are doing fine, because they're not sick. But if you look at this list here, we're doing the opposite with our children. We're not really thinking about correcting their gut microbiome. And so also they're eating cereal in the morning, a sandwich at lunch, pasta for dinner. So that's going to be our dairy, wheat, soy, eggs. These are the things that are a child's diet, chicken nuggets or, whatever it is. We're not emphasizing the vitamin D, them getting outside anymore, like children used to go outside and play. Food additives are very heavy in children's diet, as well as other sugars and dyes and things like that. We're not emphasizing a whole food diet for our children, and not even an elimination diet. So it looks like it's okay now, but what people don't realize, 3 or 4 years down the road, problems are coming. So all of this applies to all of us. And I just want parents and grandparents and aunties and uncles to realize how important this is for the children right now.
Thank you so much for driving that home. And this generation of young people, 20s, 30s and below, many of them have grown up on packaged foods and processed food. So we're seeing chronic diseases much earlier, and they expect to see, they're saying we expect to see more diabetes earlier and earlier. I'm sure you've seen, but that is a good point. We can't we have to be parents, and we have to make, good suggestions and good recommendations for what we eat, not just to give them a bag of potato chips and a hot dog and think that's a dinner.
Yeah, Get My Own says they're young and resilient, but it shows up with old age. And I think the point that both of you are making is that actually shows up before old age. And so we think kids are resilient, says, oh yeah, they can run it off, so eat the junk and what have you.
But they're not.
We're poisoning it. We're poisoning it.
But I think we used to be able to balance some of that stuff off, because kids used to go outside and interact, but they're not doing that anymore. So they don't have any balance. So everything kind of falls into this sick area versus them being able to resiliently bounce back like they used to be able to.
Yeah, it's more toxins in the system now than, I think a fast food meal is more toxic now than it was before. Not that it wasn't toxic before, but
yeah,
really laying it on.
I agree. So as far as the workup, it's just to get evaluation, but if you have any concerns or symptoms, I think it's good to do an ANA and a SED rate at least once once a year, especially if you have some of these symptoms, especially joint pains and some of these other kind of symptoms that you keep showing up. But it's interesting, only certain diagnoses will the insurance companies pay for it. I know joint pains they will, but sometimes they don't always pay for it. But I think it would be good to screen for that ANA and SED rate. And you want the ANA to be negative. If it's weekly positive, they say, well, you know, which they give you a titer, it's usually like weekly is like 1 to 40, and then 1 to 80 is borderline. Just to know if it's positive, to make some changes, and it can go back negative. And I've had people even more positive that go to negative when they make changes. So once it's positive doesn't mean it can't go back. But in addition to, whether it's x-rays, blood work, if you have pulmonary respiratory symptoms, with the pulmonologist, pulmonary function test, breathing test, blood workup, all these things, thyroid tests. But, just reminding, to ask the doctor to evaluate if you have some of these symptoms. Okay.
If you have a weekend, hey, you can always eat more hot dogs until it comes back positive, and then you can start to do something about it.
Oh my goodness. But so just a conventional treatment I put up here, but we don't have to dwell upon it, but there's a lot of different medications. Methotrexate has been out here a long time. It's a dihydroreductase inhibitor, but it is a cancer, a cancer drug or oncology medication, but they usually give it low dose in some autoimmune diseases, and it can have some benefit, but but all medications have side effects, possibly GI, pulmonary, liver toxicity, etc. There's other medications. There's anti-malaria drug, the hydroxychloroquine that's been in the news with the COVID. It's been used for years for malaria and rheumatoid arthritis, lupus, and all medications have side effects. So so we want to help you get better. We want to help the truck start rolling and fix the tires, but we don't want the back end to fall down. So we just want to keep that in mind. And then, of course, as you mentioned, Baxter, the corticosteroids, the prednisone, or the Medrol dose pack. Sometimes they're giving corticosteroids for a period of time, but they raise the blood sugar. They can cause weight gain. They can increase ulcers. They over time can be very degenerative to the joints, to the bones, cause more osteoporosis, osteopenia, and weaken the immune system. Frankly, increase the risk for infections and possibly even cancer. So all medications have potential side effects. The newer medications are the biological agents like Humira and Remicade and these kind of medications, but they are more and more expensive, and some of them, many of them injectable or infusions. It's very expensive. So if so you have to see if your insurance pays for it. But there are a lot of side effects that you want to make sure you don't have tuberculosis, because that can make it worse. It can increase the risk of certain cancers like lymphomas. And these are the potential side effects that we have to deal with. So let me go to the next slide. Was there a question that Baxter, did you want to address? I didn't know.
Someone asked about getting a daughter to eat healthy. And that was something that I thought was, it goes back to some of the earlier things you were saying. I don't know, Celeste, you might have a comment on it. Her daughter's 3 years old, and I'll throw it up here. But, she's want to eat bread and rice or something like that. But, oh, wait, that's not it.
Yeah.
This one here.
Yeah.
Rice and bread.
And so sometimes I try to get parents to realize that is sugar and sugar, rice and bread. And then also rice has issues in our country with having a certain amount of arsenic in it. I think people don't realize that too, being a major problem. So if we keep going in that direction, we are headed towards health issues very soon. And if, I can get parents to see that, yes, she's eating rice and she's eating bread, but that turns into sugar. So we're going to hit some health issues very soon because our body, especially our growing body, is made out of what we eat. So we are what we eat. If we build our muscles and bone and our brain tissue and everything off of rice and bread, then there's going to be a problem.
Yeah. I don't think she knows that. That's just the 3-year-old.
I know. And so the good thing, no, that's what I try to tell the parents.
Yeah.
Because the good thing is she is 3.
Yeah.
So you can change a habit of a 3-year-old. If she's 13, then you're in trouble, right? But at 3, you can change it because she's only 3. It's going to be a little bit hard because toddlers can be very, they have their own personality, they have their own opinion, and they can be stern, but they usually cannot hold out eating nothing for more than 2 days. I'll give them 1 day. They will do that. They will do that for 1 day, but they're not going to do that for 2 days. Now, that's where the issue comes with the parents because the parents can't hold out. But, they're going to have tantrums and they're going to be upset and they're going to cry. But again, helping the parents to see how they have the personality and the manipulation factor versus you're not starving your child and you're not being cruel to your child. And so it takes some explaining that to parents and me actually seeing this child and kind of seeing what personality she is. It's a little girl, yeah, she is, to kind of get to getting her to try some other things. But also, as we talked about before, letting her go outside, take her to a garden, let her go outside and touch some things and explain to her that this is food. And then they become interested in maybe putting it in their mouth. Now, it might be strong at first or pungent or not good, and they might spit it out. But they have a tendency to want to put stuff, touch, eat it, if you're doing it, out in the garden and in real life. And so maybe trying something like that with a 3-year-old because they love being outside. They love touching things. They love touching the dirt and taking it to that level with a 3-year-old. I wouldn't say to do that in the grocery store, as far as eating it out there. I see somebody put something about a grocery store, but I would say a garden, if you're at a garden, to do that.
I think those are excellent tips. I think with kids, I think we pass on our own prejudices to kids, our own food. So if we are eating healthy and vibrant, colorful foods, kids like things that they can touch, feel, as opposed to mushy food. So they would, they do better with things that are crunchy and crisp, as opposed to, so fresh vegetables, things like hummus and guacamole and avocado and things like that. But a lot of times if the parent doesn't have those to like those type of food, we pass those on to our children. And so we want to be careful of that, because, but I think you're right. If you see something grow, making even a bucket garden on the balcony or a backyard or whatever, and you see something grow, a bell pepper or a carrot or something, kids are involved. They would want to taste it and be a part and prepare it and find some kin-friendly meals, especially plant-based meals that are very colorful, will be exciting to do together.
Yeah, there's a question on marijuana. Another comment to follow up on what both of you said. A lot of my patients will come in and say, well, I've got the junk food around because the grandkids are coming, so they shouldn't be feeding it to the grandkids. But anyway, any comments on marijuana and autoimmune healing?
Yeah, I mean, I think marijuana can be helpful, for the muscle spasms and the tightness and the chronic pain. In Texas, we're not a medicinal marijuana state, but we can do the CBD, has a lot of benefits. But for MS, there are patients with MS that get some relief of some of their symptoms and spasms with marijuana at marijuana states. So yes, so it can be beneficial, THC and CBD. So, this slide is just kind of wrapping. We're just kind of wrapping things up. And so, as we mentioned, to be mindful of our gut health and probiotics, to try to stay away from some of the medications that can disrupt our gut, like the H2 blockers, like the famotidine, the Pepcid, the Zantac, the Pepcid, or some of the newer ones, Prednisolone. We want to try to minimize these drugs. These drugs were never meant to be taken indefinitely, but they can affect our gut, our absorbing nutrients, and cause more problems. We talked about the toxic metals. If you have toxic amalgam fillings, you want to go to a more holistic or natural dentist that removes it, gives you an alternate source to breathe, because really, when you have them removed and the vapors may make someone worse, especially with a very fragile immune system like an autoimmune patient. And so, and perhaps consider, doing things to eliminate toxic metals like lead, cadmium, chromium, things of that nature. We recommend oral chelation agents like zeolite. Some people do bentonite, but zeolite, chlorella, those kind of things are great. Zeolite binds not just to toxic metals, but also to viruses. And so that can be helpful with help from your practitioner on how to use that. Avoid processed food. Try to avoid mold exposure, not to let foods get moist or store in a humid place. Peanuts are high in aflatoxins, molds. They say corn is too. So even other nuts and other grains, you want to make sure you keep it in a dry place. And in Houston, it's very humid. And so we have to be mindful of things that can cause more mold growth. To back up on processed food, anything made of flour and, grains and cereals, those are packaged foods. And you just want to, to back up on all these additives in the food coloring, the nitrites, the processed salts, the chemical sweeteners, you name it. All right, so we had one lecture on the water and what's in our water. So we want to be mindful of clean water, trying not to get beverages and things that have been fluorinated that are touted to be good for our teeth, but that can be bad overall for our immune system and our health. The fluoride, the chloride. In Houston, we talked about there's some areas that have radiation in the water with our industries around us. We want to, just to be as careful as we can about our water, drink more filtered water, alkaline water when we can, and we can use things that take out some of the toxins like zeolite powder, which is a green powder that can be helpful in binding to some of these toxics. Our diet is crucial, and I think your diet is most powerful and transformative. And so I can't underemphasize that. I know people like, oh, here she goes again with the diet, but it's so important. What you put in your body, that's where the healing is. And so, we want to, really focus on, more organic, whole plant, anti-inflammatory, low glycemic diet. If you look for all those things, you will find more, foods, but you get back to fresh foods like out of the garden, in the grocery, and learn how to get some recipes and things to do with it. You just chop and grate but there are other things to do. If you get a dehydrator, you can make with seeds and soaked nuts. You can make flatbreads, and you can make pizza crust and other things as they have at your kitchen, Baxter, right?
Yeah, we got the comment about the rice and bread with the 3-year-old. We got a raw almond flour bread. It's only almond flour, psyllium husk, and a little bit of sea salt, and then we do sprouted wild rice. But I recently learned that a lot of wild rice is commercially grown. Floyd may know this, and so I recently resourced a place where they harvest the wild rice in it's truly wild, and they harvest it in the boats and things like that. So it's not cultivated. So we're going to start using that. So that's one thing I learned. There's a couple of questions here. One in particular about Pat Hyde. Lathrop's been on Nexium for a long time, and of course the ulcer healed. Typically, those drugs were initially designed for like 2 weeks primarily, but people are on them for like lifetimes. And so she wants to get some advice in terms of how to reverse any problems with that. And Otis Granville has a similar question regarding Platonic. So, those proton pump inhibitors can be problematic.
Yeah, I would say, just briefly, just look up a food combining diet. People that have GERD or tendency to ulcer, you want to make sure you combine the right food so you digest your foods better. And you don't want to drink your liquids with your meal. We're accustomed to having a beverage with our meal, but as we get older, we have less gastric acid, so we're not digesting it well. Then we flood it with water or beverage, and we digest even worse. So we want to learn, to do those things. Cabbage juice can be very healing to the gastric mucosa, and that can be very helpful. One of my patients healed her I think she had an ulcer with cabbage juice after she was scoped. But I'm just saying to you, there are a lot of natural approaches to that. There's a book Dr. David Brownstein wrote called Drugs That Don't Work and Natural Therapies That Do. And it is a book you can buy, but there's a whole chapter on those ulcer medications, and there's some alternative options for that.
Yeah, one thing on the proton pump inhibitors I've found in my experience, people who are on them, been on them for a long time, they develop a dependency on them. And so what we've done is we work to wean them. And so oftentimes they'll get off and say, oh, my reflux is terrible. And it may not be some intrinsic disease, but rather a dependency on that drug. And so, if you work with your healthcare practitioner and maybe go every other day or every third day and so on, we've had success in weaning people off of those proton pump inhibitors, just as an FYI to anyone else who has a question related to that. There's a question on organic veg. I'm sorry.
Okay, that's excellent. I also, aloe vera can kind of put out the fire. Aloe vera gel, aloe vera juice, taking 2 or 3 ounces 3 or 4 times a day, that coats the lining. But if it's truly because of irritation of the lining, then the aloe vera can be helpful, just as it's healing to the outside of the skin.
And then there's a question about organic veggies. If someone there's a cost issue related to that. Any comments on alternatives to organic veggies?
Right, community garden. You have to get in touch with your community. There are community gardens out there, people growing. You can water and weed, and you can take some greens home, some carrots home, or bell peppers home. So get involved with community gardens if you're not going to make a bucket garden or something in your backyard. But you just want it to be grown without pesticides, so it doesn't. But if you can afford to go to the store, then you want to get organically grown, stamped with the 9. But get in touch with community gardens. Some co-ops, you can get a box of produce for $30, $40 a week, every 2 weeks or so, depending on your budget.
Yeah, one thing I'm learning, I was looking at some videos on Hippocrates Institute, and they promote a lot of sprouting. And as I looked more into it, sprouts are a healthy way of growing veggies. You can do them year round, indoors. You don't need a big plot of land. You get seeds, organic seeds. And sprouts are some of the most nutrient dense foods around. So you can do broccoli sprouts, beet sprouts, buckwheat sprouts. And since I've been on my juice feast, I've just been eating a lot of sprout salads, and they're quite delicious. And so, you can sort of fortify your, produce by just growing sprouts, and you can organically grow them in your kitchen or wherever. So that's one thing that's just been, raised to my level of consciousness recently. But anyway, just a little tidbit. But yeah, I like the aloe vera tip as well. I'm gonna have to use that on my patients when I'm trying to wean off proton pump inhibitors. Pam, this has been fantastic. This is I like the quote by Thomas Edison. I've seen it before. The doctor of the future will give no medicine, will interest his or her patients in the care of the human frame. diet and the cause of prevention of disease. That statement rings so true now, more so than ever. I mean, we're bombarded with diseases. Not that we haven't had diseases before, but it seems like illness is the norm now. I mean, our young kids are sick, and the old people are sick, and everybody in between is sick, and the healthy are sick. I mean, because the healthier are on medications, they're just healthy and sick, or just not broken down fully. And so it's the concern I have is that it's become so normal to us. Is that we don't recognize it. We're all, it's almost like, if everybody's, left ear was falling off or something like that. And you see somebody with 2 years on and say, what's wrong with you? But it's really a problem. And the concern is that, we've accepted illness, and, we have this massive food addiction with chemicals. I mean, it leads one to ask, where do you begin? I mean, you see patients coming in, and everything's wrong, and so it's really a problem that we have to take on seriously. And I say that in the context of speaking to our audience, because I always like to say we're on a mission, and here on this show, I like to think of us being on a mission and trying to contribute toward a movement toward taking control of our own health. What we try to do is empower everyone with information to do that. But I just, by way of commentary, just want us to all step back and squint at this whole situation. And I hope many of you will share this information, not on this show for the sake of getting more listeners. That's one thing, and that's important, but not the main importance. But the important thing is to take this information, one, apply them to yourself, and in so doing those actions, other people will see you doing that, and then they'll ask questions, or they will perhaps follow your lead, but at least verbally share this information, because I think that the overall underlying message is that we have to take control of our health. We're in a healthcare crisis here, and we need to take control. It's not going to come from the government. It's not going to come from the healthcare institutions, et cetera. Just like someone raised a question about, I can't afford organic. Go to the community. Get your produce from the community. Grow your own sprouts. If you don't have the resources, then you need to become resourceful, and that's the key to that whole thing. And so I really like that take. Any final words for anybody else?
I hope the slide presentation went well. I did the IT tonight, so thank you so much, Dr. Celeste, Dr. Pamela. Great presentation. Baxter, as per usual, great job.
All right, thanks, Dr. Boyd. Celeste, any final words?
No, I mean, I just, want people to, we are here to put information out that some people have heard before, obviously, but maybe some people have not heard before, and just to kind of, get people thinking about how important our food is, and it's time. The time is now to be serious about what we're doing to our body, what we're doing to our children's body, what's happening to our children's body. Because as we can see in our current environment, there's a lot of sickness and illness around us. If you couldn't see it before, you can see it now. It's always been there, but now it's more visible. So it's time to strengthen our body and stop thinking like, oh, you all are too extreme, or this is too hard and I can't do this. You can do this. It's not magic. It takes a decision, a mental change, and you can do this with your children. I know several families who have done this with their children. It does take time. It takes some frustration and maybe some crying, and the kids are going to cry, but they will get over the hump and it will be better on the other end. So just to encourage people like this, the time is now to make these changes.
Yep. And Dr. Pamela Atkins, I'll give you the final word.
Well, I just thank you for the opportunity to talk to everyone. And I just think we live in a toxic world, so we have to live by intention. We have to live by intention. We have to plan what we're going to eat, what we're going to drink, not just to recklessly kind of, go through this world. And even to what we put in our skin, what we clean our house with, just to keep it very simple. And it doesn't have to be complicated, but I think the more we watch TV, we think we have to get certain products to clean, certain things to eat, but it can be very simple. I mean, there's a lot of simple recipes for eating, or care of our homes and cleaning products and natural pesticides that we can use. So just keep it simple and not to stress about it.
Wow, that's a great final comment, and I will leave it there. I'll see you guys backstage while I close out. As always, I learned a lot in the show, and this presentation on autoimmune disease is one that was informative from the standpoint of the mechanism of autoimmune disease. But what I like about it, it shows how autoimmune disease, like other diseases we've talked about, and that we all deal with in our clinical practices, is undergirded by our behavior. And I like Dr. Atkins' final words in terms of we have to live intentionally. And I see so many people just, getting up and, going about their day. And one of the most, many things they're intentional about, maybe their business or their school or whatever the case may be, but they're not intentional about, how they treat their bodies. They're very unintentional about what they eat, unintentional about whether they get up and exercise, et cetera. And so we need to understand that this, temple that we have, this home that we live in, on this earth, which is our human body, has to be maintained and rebuilt over time. And how we nourish it, how we fuel ourselves is extremely important. So I want to encourage all of you to, if you didn't see this whole video, take a look. There was a lot of great information that Dr. Atkins shared with us. And the underlying message, I think, is one that's very, very important, is that we have to take care of ourselves, nourish our bodies properly. And when we have these signs and symptoms, they're not just something that we should just go and, get an over-the-counter medication or go get some prescription, but our body is speaking to us and saying that something is off balance. And we need to work to get that on balance. So I hope this was helpful to you. And I want to let you know, of course, if you haven't subscribed, please subscribe to the channel. Also give us a thumbs up. This helps our algorithm. It helps get more people on the show, because more people need to hear about this. And of course, hit the notification bell if you already subscribed, so you can hear about future shows. And of course, thank you very much. But share this information with loved ones or anyone you think who would benefit from this, because I think this is a very helpful presentation and would be very helpful to anyone who needs this. But until next time, keep it fresh, natural, and live.